Good morning, everyone. So I'm going to present Pocket FundaScope, designing and 3D printing a foldable, ultra-portable smartphone fundus camera. I'm Dr. John Davis from Western Eye Hospital, Cochin, and also at Chaitanya Eye Hospital, Cochin. So commercial interest, I do have a patent pending on this, so I do have a commercial financial interest in this presentation. So retinal fundus photographs are clinically very useful and important. Multiple smartphone fundus cameras have been designed in recent years for low-cost fundus photography, that is mydriatic fundus photography. They are handheld, but they are not small enough to be carried, patented and prototyped a working foldable pocket FundaScope. That is what this is about. The aim was to design and make a foldable smartphone fundus camera that can fit inside a pocket using the technology of 3D printing for prototyping. This was done on multiple software on a computer and 3D printed using an FDM printer. And the software used was FreeCAD and Fusion 360 for designing the model, Cura and Creality Slicer for converting into a method for the 3D printer. And then the 3D printer, we used multiple 3D printers. This was a Creality Ender 3 Pro. And this is how the design was made. So I had tried multiple designs. I had tried a telescoping design, finally ended up using a folding design. And this was first drawn on paper. We tested it on cardboard and then modeled in 3D in FreeCAD all by myself. The telescoping design was not very stable, so that was discarded. This has multiple parts including interlocking hinges, joints and a case to hold the 20 diopter lens. This was printed using an FDM printer. This is PLA, could also print on ABS plastic. The design was created and 3D printed using the Ender 3 printer. Prototypes were tested and the final design was chosen. And this was used to take smartphone fundus photographs. This is how the smartphone is attached to it. This is where the lens is, and I'll show you how it works. There are several designs of smartphone fundus cameras, such as the do-it-yourself RedCam, which Dr. Biju Raju and myself had published in IGO in 2016. The Made in India MII RedCam by Dr. Ashish Sharma, Trash to Treasure RedCam by Dr. Prithvi Chandrakam, who is here, and so on. And these are all large size mydriatic fundus cameras. This new design is folding to fit into your pocket. That is the USP of this. And this is how it looks. This is how it unfolds. You unfold it and ask the patient to look into the distance and you take a fundus photograph. Right? And these are the photographs taken with this. The lens had some artifact, that is why there is some blurring here. But if you have a smartphone fundus photograph, you know that the clarity can get much better. It depends on the phone and the lens. These are some of the other photographs taken with this. These are my references. Thank you.
I think wonderful innovation, and you should present this in innovations of ophthalmology session.
Oh, he has already done.
I've done that, sir. I've
okay.
done that, sir.
Another thing is, what is the cost of this instrument?
So for me, I was working in Ramchandra Medical College, and when I used a printer there, it was free for me, except for designing and all that. So I went to a shop, a 3D printing shop outside, and asked them, I have this file, can you print this? 840 rupees.
Okay. And the comparable versions of this type of
so they sell it for different costs, 19,999.
And what is the difference in the technology of those?
They are not foldable. This is foldable. So this is better for so this is the manufacturing cost. I have a patent, so I won't be selling at that manufacturing cost.
Have you tried for patenting?
Yes, sir. Patenting is provisional patent is granted. Final patent, the full specification will be done in a couple of months. So
at present, at how many places and how many people are using this?
So this is only in Ramchandra Medical College. So I was there in Ramchandra Medical College for the past 2 years, and now I have come back to Cochin. So it's there only in 2 places as of now. I have shifted back to Cochin, which is my hometown, So Chennai and Cochin, two places.
Were you in the mood of asking others to utilize it and
Yes, sir.
share their experiences?
Yes, sir. So I have taught my postgraduate students and my colleagues there in faculty colleagues in Ramchandra Medical College to use it. There is the same learning curve as a smartphone fundus camera. If any of you have used a smartphone fundus camera, there is a learning curve in aligning it. So I actually teach them that one of the hands has to go to the brow of the patient so that this is aligned properly. Many people don't tend to do that. And then the phone has to be perfectly centered for the illumination and the camera to go through the same lens. And then you have to zoom in a little more. And if you are comfortable, you can use a regular phone camera app, or you can use the Ullman Indirect app, or the MIA RedCam app, or the HopeScope app, which are other apps which have settings for adjusting the focus, illumination on, and saving the images in a EMR-like system.
I think whether you have tried it or not, but I'll suggest you one thing.
Yes,
Give
sir.
this piece to somebody else who is using other versions.
Yes, sir.
And then ask that comparison.
Yes, sir.
What that person feels, whether some lacunas are there in that model or this model, what extra thing you can improve upon, like that.
Yes, sir. So I have do-it-yourself RedCam, I have HopeScope, and my colleague there has the MIA RedCam. So I asked them to use all this. This was very, very convenient, and the learning curve was exactly the same. In fact, even though they had the HopeScope there, they were not using it because it was too big to carry around and use. So once this was there, they were able to take it to the bedside of patients, take fundus photographs. So the learning curve is exactly the same. The convenience is much, much more.
One more thing, why you have written FundaScope for your patency?
Yes, sir. So my name is John Davis, and I call myself Jonda Funda. And so that is why I named it
Okay,
Jonda's
it is not typo, it is not
FundaScope.
spelling mistake. It is
No, sir, it's a
specifically your
FundaScope.
Ah,
It's Fundas.
that is the reason.
My email address is Jonda Funda. Website is FundaZone.
You can make it without foldable also. You can make
I made a telescoping one.
not telescopic, with the same design.
No, I wanted it foldable so that it fits in your pocket.
You don't carry a pocket every time you are a doctor. You can carry a small bag. So
That-
when you are making a foldable,
Yes, sir.
the cost is also increasing.
No, sir, the cost is not increasing.
Because the whole story is with the lens only.
Yes, sir.
And
This, in addition, it works as a case for the lens. So that is the advantage. The other devices, they are big. You need to carry a bag to take it along. Because of that, the people who bought it and kept it there were not using it, because unfortunately, people are too lazy to carry a bag along just because,
Okay.
It's very nice innovation, but you need to compare as.
Yes, ma'am. So the studies are ongoing. I haven't gathered information yet to do a comparison study.
Any comparison you have never done? In the paper also you have not.
No, sir, not. This is very recent. This is last part of COVID innovation.